Yes, I already fixed my shoulder right there.
Mm-hmm.
And distal right there.
Mm-hmm. Okay.
And this in the back. Yeah.
Got it.
Over these parts.
Got it. Okay.
So,
Have a sit down. So let's clarify. So what we're seeing here, okay, this right over here, this is a ganglion cyst. Okay. And how long that's been going on?
this every 8 months.
About 8 months.
Yeah, 8 months.
Here, near the fibular head, causing pain all straight down to this way,
Yes.
right?
Yes, only with this.
And how long this been going on?
This 4 months.
4 months.
Mm-hmm.
All right. All right. Let's get to work. Okay. So there's 2 areas that we want to take a look at neurologically wise. Okay. I want to focus what's going on in this region over here. Okay. And also this region over here. In addition to what's going on now, the diagram over here shows this is where it's involved. Okay, with the fibular head right over here, with the common peroneal nerve. Now we have something very similar on the opposite side, on the left side. That's where you're feeling that discomfort. Okay, so now what we're going to do is this over here. We're going to take a look at this region over here. You see how the nerves trace all the way straight down to this region right over here. We're going to take a look what's called that ganglion cyst. And I want to take a look all at the source, straight to the base of your neck. Next component, we're going to take a look at the structures over here, any potential structural abnormalities that may cause a significant rotation in your knees and cause the irritation to that common peroneal nerve over there. Okay, there are several structural abnormalities we identified on this x-ray. Okay, so in the spine itself, we have this foundation over here. Okay, it's significantly rotated towards this way by 5 millimeters. So right over here, and you still have a rudimentary disc at the sacrum, we need to correct this one over here.
Alright.
In addition to this 5th lumbar over here, we may need to address this one in a future visit. In addition to your 2nd dorsal vertebrae right over here, we need to address that one. Okay, that's the one that's radiating all straight down and may be responsible for that ganglion cyst. The next structural abnormality we identified is this. Overall, the carpal bones, okay, the bones in your wrists, okay, they're not that bad. However, what we have identified is this radius bone over here. Okay. It should be, right now it's over here, and it should be here.
Oh, down.
Exactly. So, in your case, right over here, okay, this bone over here, the radial bone, shifted significantly upwards over here. Okay, so as a result, it irritated the nerves and possibly causing that, possibly causing that ganglion cyst as well. So we need to correct this and also the 2nd dorsal vertebra as well. In this structural analysis, and what we see in your knees, I want to see this parallel. Okay, right now it's gapped open like this on this side over here. Okay, so that tells us this bone over here, there's significant rotation over here. Okay, but more telling is over here, the fibula bone, I want to see a little more forward. Okay, but yet it's backwards. There she is, right there. Right there. So as we can see over here, there's quite a bit of swelling on the left side versus the right. And we're going to motion palpate this one over here. It doesn't move at all. It's stuck on the left side. Freely moves on the right. You feel that difference there? See, now we're going to check your right hip. Moves forward and backwards without a problem. Left hip moves forward and backwards without a problem. So we identified that sacrum. And more importantly, we feel a little speed bump right there. So it's the 2nd sacral segment right over here. That's the one we need to correct. And again, we see, we also see quite a bit of swelling on the left side over here, not too much on the right. Muscle spasms, much more on his left side versus the right. Quite a bit of swelling right underneath here. And if we motion it right here, it's stuck. It's kind of tender on you, right?
Yeah.
Yeah. Okay, that's number 2. Yeah, oh, just a second. Oh. Good. Oh, strong. Good. Now this ganglion cyst over here, okay, as we mentioned before, you have a posterior distal radius. So in other words, this bone over here, it went this way. So what we're gonna do is we're gonna set it over here.
No.
Mm-hmm.
Alright.
And keep in mind, it's not gonna go away, not like that.
No, okay.
Okay, right. It needs some time for this to drain and also the nerve to calm down and the nerve inflammation, the swelling to calm down as well.
Alright.
Right? So relax this over here, just relax. Relax, just relax. Yeah, we're just gonna pump this up first. Now bear in mind, okay, I'm not touching the ganglion cyst at all. We're just contacting right over here. We're just pumping it down here. Okay, I'm just gonna open it up. Closer to set. There it goes. Okay, what's different?
No, yes, more smooth. This moved the
More what?
my hands.
What do you mean, flexibility?
Yeah, it is more fixed, yeah.
Hmm.
The other one's not too much, this a little sticking over here.
Okay.
These two, no, not too much movement. This now, it's good.
So that's what you're saying? So as that was before, you did not have too much movement?
Yeah, it is.
Now you have more movement?
Yes, more movement, yeah.
Okay, good.
Yes.
Right. Ready for the next?
Alright. Yeah.
Okay, so the next component, what we're going to do is we're going to help you with this common peroneal nerve entrapment you got going on. And the reason why is because this fibula, the fibula head, the proximal fibula head, okay, it went posterior when it should be a little more alignment here. So because this bone over here is not backwards, that's the reason why you got this significant swelling right there. And all that swelling, because the common peroneal nerve is so superficial, meaning it's so close to the surface, all that swelling, what it did was, you pretty much push it right against the edge, exactly, and pinch the nerve. That's why you have that complete obstruction radiating all the way down to the foot, right down there. Okay. So we're gonna realign that fella back into place. Just relax. So right now we're right on the fibula head. Okay, we're just gonna motion that fella before we set it. Not too bad?
No, it's a little bit.
I understand it's a little painful.
Yeah, alright.
Okay. So what we're doing right now is we're preparing the joint, get all the swelling as much as possible out of the way before we set this fella. Because what we don't want to do is further irritate the common peroneal nerve.
Yes.
Okay.
Okay, good.
What's different?
No, it's a little different, yes.
So what's the need?
This is no more.
No more what?
The problem here,
Mm-hmm.
they move it more.
Now you can move it a lot more?
Yeah, it's more, yeah. This is not
Good.
too much movement. You solid sticking like that,
Mm-hmm.
it's no more. This I move around more.
Now you have full range of motion?
Yeah.
Yeah.
So
How's the foot now?
the foot's always a little bit, so just fix that one, maybe it's
Mhm.
here, this part.
Okay.
Maybe.
So what's different on the foot before and after the adjustment?
No, yeah, it's a lot different. This more movement. You see that one?
Good.
It's more. Yeah.
How do you like that?
It's more.
It's amazing, isn't it?
Yeah. It's good.
Yeah, so that's what we're talking about. So we corrected the fibula over here,
Mhm.
restored the common peroneal nerve, and that's why that foot getting a lot better already.
As well, yeah.